Thanks for inviting us in tonight. More than 2,000 Hoosiers are in the hospital right now because of COVID-19. Hospital workers tell us they're at their wits' end, overwhelmed. In fact, some are ready to just throw in the towel. So tonight at 11, we want to start our big story with the words from a frontline fighter whose honest account of hospital struggles has really struck a chord with hundreds of Hoosiers.
This is the face of a woman nearly at her breaking point. Look closer and you'll see a red mark on the bridge of her nose. That's a pressure sore from the respirator she wears hour after hour so she can safely treat COVID patients. That look in her eyes, that's sheer exhaustion. After more than a year of watching so many patients die from the coronavirus, she's lost count. Meet Jennifer Tingatella, a patient care coordinator in the ICU unit of Community North Hospital.
COVID just destroys people. It is frightening.
Jennifer thought she'd remind people just how frightening in a post she made 2 weeks ago on social media, including on LinkedIn. Her post garnered more than 8,000 reactions and more than 1,000 comments.
It just exploded.
Something Jennifer wasn't expecting, including the negative reactions to her words, some accusing her of pushing an agenda.
That's why we haven't really been able to get over this COVID nightmare. Is there's just so many people who just think they know better than science. I don't have an agenda. I just know what I have been seeing for 18 months. And it has definitely, it's changed all of us.
Jennifer says the day she took the picture, she just spent 2 hours in a room treating a patient with COVID.
I honestly, at that moment, was just like, how much longer can we all do this?
It's a question even 2 weeks later, Jennifer says she and her colleagues can't answer. What she does know, though, is that she's seeing more normally healthy people in their 30s and 40s ending up on ventilators.
They're gasping for breath, and they're breathing like 50, 60 times a minute.
Jennifer can't show you that, though, because of patient privacy. But what she can show you is the face of a registered nurse working at a hospital whose resources, she says, are stretched thin.
And when I say resources, I mean actual people to take care of these patients.
People like Jennifer, still in the trenches fighting a deadly virus. Her face and this post, a reminder to people who doubt COVID can kill you, that it's still here and not going away. And it's something Jennifer is confronted with every day.
They don't want to hear our reality. We're not the healthcare heroes anymore.
Let's give you a closer look at just how full hospitals are in the state of Indiana. The latest federal numbers show that 71% of inpatient beds are full across our state. Let's put it this way. 1 in 6 patients is a COVID case. Now, the woman Emily spoke with mentioned ICU patients, so I want to give you a look at those numbers. Right now, 83% of intensive care beds are full across the state of Indiana. So that's a lot of Hoosiers needing critical care right now. And more than 1/3 of beds are filled with COVID patients. Now, we've seen the last few months, the odds of getting seriously sick with COVID and ending up in a hospital are actually lower for people who get the vaccine. So Chris Vanderveen dug into the difference the COVID vaccine can make for our overwhelmed healthcare system.
Let's talk waves. No, not those waves. COVID waves. In 2020, every wave of cases resulted in a similar-looking wave of hospitalizations and deaths. As cases increased, a week or so later, so would hospitalizations. And as hospitalizations increased, a few weeks later, so unfortunately, would deaths. Eventually, the cases would peak, the wave would crest, and hospitals would start to calm. Which brings us to a critical goal of vaccinations. With Delta circulating, we know we're going to see more waves. The key is, will the vaccine ease the hospitalizations and deaths that routinely followed last year? Take the United Kingdom, for example. A few months ago, cases once again started to rise quickly. Another wave was upon them. But this time, in a country with more than 60% of its residents vaccinated, the case wave was not followed by a similar increase in hospitalizations. Look, while cases jumped like this, hospitalizations didn't. The two metrics, in essence, decoupled from one another. That's a good sign the vaccine is working by preventing the most serious of cases. Problem is, that's not what we're seeing in many states in the U.S. Look at Idaho. and Tennessee, for example, two states far apart. Both have seen recent record case spikes, which have led to sharp and record-breaking increases in hospitalizations as well. No decoupling in either. There are now more people in Tennessee and Idaho hospitals than at any previous point in the pandemic. Why? It's not entirely clear, although pockets of both states remain highly unvaccinated and thus unprotected from the virus. Why pay attention to this? Because as long as cases and hospitalizations continue to rise in unison, it's going to be tough to put these waves, and thus the pandemic itself, behind us.
We've seen several hospitals announce vaccine requirements in the wake of this latest COVID surge. In fact, today, IU Health let 125 employees go for failing to meet their mandate deadline. Workers were allowed to apply for deferrals and exemptions, but those who did not qualify and then failed to get the vaccine by the start of this month were placed on suspension. And now here we are weeks later. Those who still refuse to get the shot no longer work at IU Health.